In this video we're going to have a look at the lateral hip control series. When we're talking about lateral hip control, we're talking principally about the deep hip abductors, namely glute min and anterior glute med, and the role that they play in stabilising the lateral hip to allow the larger, more superficial muscles to produce torque and forces around the lateral hip joint. If we're looking to assess function, we can have a look at Sinead lying and sideline. Optimal function of the hip abductors, or the deep hip abductors, will see her active range equal her passive range. In straight side lying with her hip in neutral, if we ask Sinead to lift as high as she can through range without compensating, and we support the hip joint, we can see that when she's lifted actively as high as she can, she still has 10 to 15 degrees of passive hip abduction afterwards. She cannot control all the active range that she has. This is not because she's not strong enough to lift her leg, but she lacks that deep stability to allow the torque producers to control the hip joint through range. The main relationship with this with athletic groin pain is twofold. Number one is because of that lack of control laterally, we can end up with dynamic impingement of the hip joint. Or secondly, because of the compensations in trunk sway or pelvic rotation during more dynamic hip movements, we can see overload of the muscles and structures across the anterior hip and pelvis. The entry-level exercise for the lateral control stream is supported hip hitching. In this position we use the stick for some balance and support, bring the free leg up and internally rotate the hip so we can bias glute min, and from there we reach up into the sky, abducting our hip through pelvic hip hitching. Looking at this exercise from a side view, you can see the importance of maintaining hip and knee extension, some internal pelvis rotation, and as we reach up to the sky, we should feel the burn laterally over glute min. Common cheats in this exercise are to flex at the hip and knee as we reach, thus unlocking the hip, or alternatively, with the knee straight, to externally rotate out of the movement, thus feeling the burn more posteriorly as upper glute max and posterior glute med try to compensate. Therefore, it is essential that we maintain hip and knee extension, some internal pelvis rotation, so we can feel the burn primarily over the glute min muscle at the side of the hip joint. The further progression of this stream is a walking hip hitch. Here we're looking to combine that pelvic hitch and hip abduction through a more dynamic movement requiring greater stability. Again, the key focus is feeling the burn or most activity through the lateral hip, principally over glute min.